So I'm here on location today, downtown Vancouver at St. Paul's Conference for Primary Care Physicians. We've got some great pieces coming up. Today we're going to talk to doctors about the prevalence of kidney disease in their practice. What kind of symptoms do they see from patients who walk through their doors? As we know, the symptoms for kidney disease are often silent, and early diagnosis is really, really important. So we want to hear from primary care physicians, the ones on the front lines. What do they see each and every day in their practice, and some of the things that they can share with us so we are aware of those risk factors. So please don't go anywhere. We've got a great show coming up. One of the things that I was kind of curious about is, in your practice, your current practice, do you see a lot of patients coming through with symptoms for kidney disease? And if so, what does that look like? Can you talk a little bit about that?
Yeah, so I was really surprised to see the number of patients I see day-to-day life who has no awareness of any kidney disease that they are having, especially patients with diabetic. Diabetic nephropathy is a very common thing I see in Alberta, in Calgary, where I do work. The other thing is I also have noticed IgA nephropathy, which is some accidental finding, along with we do a routine checkup and we see some abnormal kidney function, and then we go behind and we find that patients are having IgA nephropathy. That is especially from Asian crowd, I see that more. So it's a good awareness that we can pick up certain things from a routine annual checkup even. And especially I have also patients with the high blood pressure. It is very important to watch out for proteinuria, which is where we see in routine urine test that amount of protein is being excreted, and then we pick up from there and we go behind. So I think the Kidney Foundation is doing a great job, and also especially people with the IgA nephropathy, diabetic nephropathy, people who have end-stage kidney disease have no hope having a transplant option, and we can register and teaching them, and also the dialysis that you have started at home, which they can feel comfortable and keep doing. So I really appreciate your foundation and your hard work, and I'm excited to go forward.
Can you just, you mentioned all the big high risk factors in there, diabetes, high blood pressure, certain ethnic populations. So in your practice, your current practice right now, how prevalent, I guess, would you say sort of the diagnosis of kidney disease is?
You will be surprised to know that it is quite a major amount that we find now, unlike before. I don't know whether we were aware of it, or now we look for it, or we pick up routinely. It's all adds up and numbers are increasing. And the lifestyle and the renal issues with which people come is more, they are more knowledgeable. They read up and they want to, I feel puffiness of face, or my blood pressure is always up. Doctor, is there anything wrong with my kidney? These are the strange questions that we hear from them now these days. So I think they are learning more about kidney diseases. I don't know whether your foundation has anything to do with that, but people are more aware of what to look for, how to report to the doctor.
Actually, that is very good news to hear, because, one of the things that we always say is kidney disease often flies under the radar. And so a lot of people are not fully aware of what the risk factors are. And sometimes in the early stages, you don't even see symptoms until, their kidney function has dropped to quite a low level. So it's good that the awareness is up. And that is certainly a major thing that we're trying to do is to push out, early education, early awareness of kidney disease. When you have a patient that has been just diagnosed with kidney disease, what are some of the common things? I mean, you think about, holding those numbers as long as possible. So are there certain things you may recommend in terms of diet and exercise?
So the most important is connecting them with a good dietitian who can give you some headlines, what to eat, what not to eat, and how to be, in the importance of having more fluid in your system. What are the signs to look for when you are dehydrated? How to rehydrate? So all these are important points, I think, as a common. Normal people, they can ignore and can get into severe kidney problems. The most important thing I feel that is the diabetic patients, when they are dehydrated, they can get into ketoacidosis and can have acute renal failure, and the drugs that they should be avoiding, like NSAIDs.
Absolutely. Well, those are great tips there, Dr. David. Thank you so much for that. I know you're here today. You're down here at the conference, the St. Paul's Conference for Primary Physicians. How's it going so far?
As I said, this is my first visit to this convention, and I'm so surprised to see there are 1,600 family physicians attending this, and it's been saying they're sold out. I thought, what is that? Sold out the conference seat? That was amazing, and we get connected with so many different physicians who work in different situations, like emergency physician doing both the locums, physicians doing only office-based family practice. We have been given so much opportunities to see and connect and learn a lot, and the topics to this year's conference was excellent and fabulous. I am enjoying. I learned a lot.
That's great to hear. Thank you so much, Dr. David. Appreciate you stopping by.
Thank you very much.